Well, my past work in medical education, I guess, really started when I myself was in medical school, and I think the neat part about medical school is you get a group of friends and you really sort of form study teams. Medical school, I think, is not difficult because for me it was what I was doing what I loved, but it was a lot of material to learn. So even as early as medical school, we began educating each other as we did study groups. When I then became a resident, your responsibility as a more senior resident is to educate the junior residents as well as medical students. When I graduated residency and went into practice, I stayed actively involved in covering the residence clinic as well as interacting with the medical students. And my first official sort of title in medical education or position was I became the director of undergraduate medical education. And then I was really responsible for all of the medical students that rotated through obstetrics and gynecology and ensuring their curriculum, doing feedback with them, doing case reports with them, reviewing their history and physicals. So actually I started out as a clerkship director or director of undergraduate medical education, and then became the director of medical education, then became a residency program director, which was a role I've held at two different positions, which then ties into CREOG and the RRC, and then have done some work in the position of academic compliance within medical education, and that's supervision and coding and making sure that everything is being done appropriately at that level. Then moved to a vice chair role, and then became the chair. So my entire career, which started with my own education and now as chair, has really had the theme of medical education weaved through it on a daily basis. We're extremely excited about the Virginia Tech Carilion School of Medicine and our inaugural class beginning August 2nd. And departmentally, several of our physicians and my colleagues will be participating in the LACE program, which is the longitudinal education, as well as being a preceptor and a block leader. We're very excited about our medical students rotating with us on obstetrics and gynecology and being able to expose them to what is obstetrics and gynecology, and because it is more than just delivering babies and C-sections and hysterectomies. The other thing I hope that my personal work through the organization helps is again emphasizing the total picture of what makes a healthcare provider. That's beyond your SAT scores and your MCAT scores and your board scores, but the ability to communicate, the ability to empathize, the ability to recognize interpersonal skills, the ability to very constructively give feedback and receive feedback. The role of the Residency Review Committee in medical education is that it ensures the consistency of education for residents across the country and the similarity in the training and the expectations for all residents. And there are guidelines that are put into place by both the ACGME as well as the Council for Resident Education in Obstetrics and Gynecology on objectives for education, surgical training, supervision of the residents, and in addition to that, there's competencies that go beyond medical education and in our field, surgical skills, and those are competencies which many of us feel are very, very important and broaden the picture of a physician entering practice today. And those are the competencies of communication, professionalism, and that also stems into interpersonal skills, because we know that a very, very important component of being a well-rounded physician and a well-rounded healthcare provider goes beyond just medical care and surgical skills, but being able to relate and communicate with your patients. So the Residency Review Committee is charged with the task of reviewing what is called the Program Information Form, or the PIF, and all the information that a site visitor does, and ensuring that all of the competencies are being met and that residents are having equal exposure and equal training. Association of Professors of Gynecology and Obstetrics is an association which really is dedicated to medical education, but in particular medical education at the medical student level. While they're also they have impact on resident training, it takes it a step back and looks at what are we teaching at the medical student level. So again, things like interpersonalism, workshops, modules, as well as surgical skills, training skills, simulation. How are we structuring medical education in medical school and at the professor level so that folks really do graduate medical school very well-rounded as a total picture, similar to what we're doing here at the Virginia Tech Carilion School of Medicine, in that we're going beyond just, do you know the facts, do you know the antibiotics, have you memorized all your muscles, insertions, and all the functions, but we're doing interpersonal skills, communication skills, and the interprofessionalism.